Welcome everybody, my name is Dr. Julie Oliver and you're tuned into GP Notebook TV for your learning today. So this video is a trial that was published in The Lancet in May 2021, and it was a trial that was looking at ovarian cancer screening. Now, why is this important for us in primary care? Well, it's really important because we know there's screening for both breast cancer and in women's health there's screening for cervical cancer, but we do not as yet offer any sort of screening test for ovarian cancer. So this is important to be aware of what's going on out there, because women might be coming in and asking us about these tests, just like the men are coming in now and asking us for PSA screening, and we know the limitations behind that. So this was called the UK Collaborative Trial of Ovarian Cancer Screening, and it was a randomised controlled trial. What happened was they recruited women from the UK into this trial, and they recruited about 200,000 women, so really big numbers, and they split them up into 3 groups. So the randomised control section really did no screening at all in the control arm, and the 2 groups that got an active screening test either had an ultrasound scan or they had ultrasound and CA125 testing. And they followed a protocol depending on what those results showed. So why is this important? Well, at the moment we know we haven't got a screening test. So did this study show us that screening showed any difference to the mortality rate of ovarian cancer? And sadly, there was no difference in the mortality rate of ovarian cancer if you were screened for it, and it didn't matter which screening process you had, compared with if you had no screening. So once again, this evidence shows us that we do not have any good research to promote or encourage screening for ovarian cancer. Now remember, this is different from actual women presenting with symptoms, and the NICE guidelines that show us about symptom presentation and potential ovarian cancer say we should be doing our CA125s on women that present with all sorts of bowel-like symptoms, women that present with bladder symptoms, or things like feeling full up quickly or lethargy or weight loss. So that would be outside a screening programme, because remember, these are symptomatic women. But at the moment in primary care, we have not and should not be offering women CA125s as a screening toolkit for ovarian cancer, because what we know is it does not make a difference to the outcome, which would be death from ovarian cancer, by offering this test. So there'll be a link below to the Lancet study if you want to look at it in more detail, and I'll also include a link below to the NICE guidelines on symptoms presenting potential cancer symptoms. So thank you for tuning in for GP Notebook TV for your learning and your education. More videos to follow. Take care, everybody.